Today I will say something about the medicalization of existential problems and how psychotherapy and in particular philosophical counseling look upon that medicalization and what alternatives they seek to provide. The dominant way of understanding psychological or psychiatric disorders by official psychiatry is one based on medicalization, which means if you have such problems which cause difficulties in your functioning, which make it difficult for you to relate to other people or do your job reasonably, efficiently, or participate in various common activities of your family, at your workplace, in your neighborhood, in your society, then psychiatry would look for diagnoses which best describe your symptoms and would seek to label you as suffering from one or another psychiatric disorder. In some cases this is positive, this is constructive, because some problems, some practical functional problems arise from cerebral issues, from issues with the central nervous system and require medication and require medical treatment. However, many of the problems which we come across in our everyday lives are based on our understanding of the situations in which we find ourselves and our ability to process difficult times and difficult experiences. And they don't necessarily need to be medicalized, or they even shouldn't or must not be medicalized, because such medicalization doesn't help solve the problem. In recent debate among many enlightened psychiatrists and even more applied philosophers, specific psychiatric diagnoses have been made the subject of critique. This is especially the case with a diagnosis of the so-called personality disorders. Personality disorders are considered to be problems in the integration of one's personality traits, habits and behavior, which create all kinds of difficulties for the person in dealing with the outside world and with their own feelings, and which at the same time make that person a difficult one to be handled by the society, by schools, by employers, by social institutions, etc. So personality disorders are classified in many ways, and many of these diagnoses of personality disorders overlap with various other diagnoses, such as diagnosis of various psychoses, neuroses, many other types of psychiatric problems. However, there are 4 diagnoses of personality disorders, the so-called cluster B personality disorders, according to the official systematization of psychiatric disorders in the Diagnostic and Statistical Manual, the infamous DSM, which is the main globally recognized official source of diagnosis and directions for treatment. Those 4 personality disorders are particularly revealing in the way they are described and in the way they are diagnosed about the problems with psychiatric diagnosis more generally. The 4 personality disorders include the antisocial personality disorder, which is sometimes colloquially called the psychopathy, the borderline personality disorder, the histrionic, so-called histrionic personality disorder, and the narcissistic personality disorder. And if you look at the criteria for making these diagnoses, as Louis Charland wrote in his infamous critique and the Journal of Personality Disorders in 2006. The terms which official psychiatry uses to diagnose personality disorders, these 4 personality disorders specifically, are predominantly moral terms and not predominantly clinical ones. Which means that psychiatry talks about disorders arising or reflecting in one's inability or unwillingness to care for other people, to empathize with others, to recognize one's duties and obligations towards others and towards society, one's reckless behavior, one's unwillingness to participate in collective actions, in common efforts for the greater good of everyone. Generally, one's behavior, which is describable in moral terms as selfish, self-centered, socially insufficiently aware, and generally morally problematic. So according to Child, many of the people diagnosed with the cluster B personality disorders would be labeled as morally inadequate in more philosophical terms, and there would be a natural situation and opportunity in working with those people to discuss their moral values, their ways of moral thinking, their perception of self and others. And all of these things make up a philosophical discourse, a discourse which can help a person use one's rational faculties to evaluate and improve one's position vis-a-vis the other people and one's life in general, increase the quality of one's life and increase one's value for the quality of the lives of others. Psychotherapy is a particularly good fit for this moral understanding of personality disorders because it sort of builds its narratives, it builds its therapeutic impact on a person through a structured discussion. And the rephrasing and reframing of a medicalized understanding of one's condition into a narratively formulated problem allows this discussion to take place. What am I trying to say? If you approach a person as one suffering from a narcissistic personality disorder, you start from a position of psychiatric labeling which has a very weak foundation in clinical terms and clinical research. You use a largely arbitrarily designed clinical term for something which clinicians themselves describe in moral terms. Whereas if you approach the same person as one with moral dilemmas and potentially confused moral priorities, you first create an even playing field. You approach the person as your equal, and you automatically open up the room for a trustful and meaningful discussion. And you also introduce rules which are optimizing, which encourage the active quest of solutions. And these are the rules of rational discourse. If you talk to a person rationally and impassionately about her values and her reasons for acting this way or that way, without necessarily suggesting that there is something medically significant about the person's choices and actions, you place that person in a position to explain and argue her point of view. And once this dialectic of argument is established, there's reasonable chance of significant progress, because you can convince someone by using rational argument that their values may be misplaced, or their ways of perceiving the world may be inadequate. So psychotherapy and philosophical counseling in particular tries to persuade people, tries to argue with people, and tries to encourage people to learn and to change through learning, rather than being labeled as suffering from a medical condition. There are grave doubts as to whether there actually are such medical conditions as personality disorders, or these conditions are in fact moral conditions. Obviously, some of the most recent neurological research suggests that you can't really separate moral reasoning from a biological and medical perspective, because some areas of the brain which are responsible for the making of moral decisions both determine those decisions and respond to certain types of behavior because of the so-called neuroplasticity of the brain. So the central nervous system both determines our actions and responds to our choices, which means that our choices shape our central nervous system as much as our central nervous system determines our choices, which is an interesting scientific line of research. Now, granted that there is a parallel in biology and neurochemistry of the brain, we can still consider many of the personality disorders as conditions which may be susceptible to psychotherapeutic interventions and philosophical discussion, which may improve people's behavior and people's understanding. And in this sense, some philosophers play with the concept of moral re-education, which sounds variously to various people. It sounds optimistic, emancipating, or Stalinist and repressive. Moral re-education assumes that there is a procedure by which you can sort of change someone's moral values and moral reasoning and thus change that person. But in fact, any psychotherapy aims at changing people. And most people who come for psychotherapy come with a desire to change, to become more able to act optimally in their lives, to be able to achieve a greater degree of affection in their lives and satisfaction, and to increase the quality of their lives. So there shouldn't be anything necessarily controversial in the idea that we seek to change people through counseling and therapy. Now, moral re-education is a particularly promising perspective because it allows us to think of psychotherapy as a joint examination of fundamentally moral issues with our clients, which will afford our clients the opportunity to reflect on their customary ways of thinking about values and morality, and which will also allow us as therapists to learn something new and perhaps question our own ways of relating to others and understanding moral values. So moral re-education as a perspective of counseling and psychotherapy is a fundamental alternative to the medicalization of moral problems. And with personality disorders we face particularly acute controversies within modern science and modern humanistic discourse, because it is not at all clear what personality disorders really are and whether they really ought to unequivocally be described and treated as medical conditions. Because in the same way in which one may medicalize the histrionic or narcissistic or antisocial behavior, one can medicalize any kind of socially unacceptable behavior. And it can only be a matter of degree before something which is normally considered as the breaking of moral norms and social taboos is medicalized as a mental illness. Now, given that many people who suffer from personality disorders tend to be highly functional in everyday situations, it is not so easy to treat them unequivocally as medically ill people. It is not even easy to intervene in situations when they create problems, because many of them tend to bounce back very quickly after the episodes which they have, which are particularly destructive and may seem as good opportunities to involve the medical system. So the only way to really work with such persons and to help them develop their potential and maximize their quality of life is to treat them as equals and to get rid of these unnecessary medicalizations. And this applies to every aspect of counseling and psychotherapy. The authority of the therapist or counselor lies with the ability of him or her as a person to show respect for their clients and to elicit respect by their clients and to establish a chemistry which psychology calls transfer and counter-transfer, positive feelings which the client develops towards the therapist, and in turn the positive feelings which the therapist develops towards the client, and work with that dynamic force of mutual attraction, of affection, to bring about the best in the client. And whether the client is considered to be a person who has made a mistake or has been caught up in a particularly bad and trying set of circumstances in their life, or one is considered by the psychiatric profession to suffer from a personality disorder, the difference is really insignificant for the psychotherapist. The psychotherapist needs to provide the client with that kind of interpersonal taste and interpersonal atmosphere and environment in which the client can flourish. And once the conditions are created for a person to flourish, it becomes irrelevant whether somebody else looking from a side would call that person personality disordered or not. So psychiatric diagnosis, to a large extent, not all of them, but to a large extent, they do tend to be arbitrary. After all, they are formulated by a democratic procedure of voting in the American Psychiatric Association, so they're not the subject of some kind of rigorous process which takes account of the etiology of chemistry or physiology of certain disorders. They are largely based on an observation of symptoms and a social classification of those symptoms as constituting an illness or a disorder, and they often change. Until a few decades ago, homosexuality was classified as a psychiatric disorder, and then it was removed from the DSM. So psychiatric diagnoses are not the same type of diagnosis as diagnosis in oncology or internal medicine. And they shouldn't be treated with that level of rigor. They should be subject to critique, and psychiatrists should be much more open to critique than doctors of other specializations, especially given that for some of those diagnoses there are stereotypes in the psychiatric profession that they are very difficult to treat, and this applies to personality disorders. Now, if you medicalize a description of one's behavior and call it a personality disorder, and then in attempting to treat it by medical means, you encounter unexpected difficulties and find it extremely unresponsive in many cases to medical treatment, then logically you should ask yourself whether it was a mistake to call it and consider it a medical condition in the first place. So psychotherapy offers all of those options which medicine does not, and it is a way of humanely and respectfully approaching other people in order to provide them with sufficient love and acceptance and warmth and understanding to encourage them to bring out the best in them. And that really is the essence of philosophical counseling as the most modern and perhaps the most inclusive type of counseling and psychotherapy in general. I do think that philosophical counseling is a type of psychotherapy because the elements which link it with psychotherapy, which connect it with psychotherapy, are much more numerous than those characteristics of philosophical counseling which set it apart from psychotherapy. Psychotherapy is also developing with time. Today we can no longer talk about many of the aspects of psychotherapy which traditionally belong to conservative psychotherapy. So as psychotherapy changes, so do similarities between psychotherapy as a generic approach to healing and philosophical counseling are increasing. Now, to say all of this is not to suggest that some people should not be treated medically rather than through talk therapy. There are many conditions which are indeed medical conditions, cerebral conditions, and they require medication and they require medical treatment. However, as I said at the beginning, we should always seek to resolve specific issues in our lives, specific existential difficulties with which people overwhelmingly come to psychotherapy by generating an environment, an intersubjective social environment between the counselor and the client, which will give the client the tools to deal with their problems and examine and always re-examine their views of life and their views of values, because values are our convictions, our attitudes about what is the most important in our lives, which guide us through our lives. And confusions about values are the subject of philosophy to a large extent, and this is where philosophy can make the most significant impact in psychotherapy, in providing a forum for the examination and clarification of values, and this is not what the medicine cannot do there. So psychotherapy cannot really exist without philosophy, and it has never existed without philosophy. Most psychiatric schools and approaches had arisen from various schools of philosophy. And in psychotherapeutic practice, therapists always use a good deal of philosophy in order to deal with clients' existential problems. Likewise, philosophy also needs to incorporate a lot of the instruments and interventions and skills developed in psychotherapy in order to be effective as a helping profession. And both professions, in fact, describable by the generic term of psychotherapy, both of them, are really firmly couched on this idea that dialogue is an instrument of healing, a dialogue which is properly structured, based on proper value assumptions, on a proper format, and characterized by a high-quality relationship between two individuals, the highly skilled and highly qualified and highly caring therapist and the trusting and client who is keen to actually resolve one's existential issues. This is the setting for psychotherapy which removes any need for medicalization of either behavioral or social issues which we ordinarily address in psychotherapy.